Hi, we're students from Texas Lutheran University currently taking medical terminology. This is for a project for our class, and today we're going to talk to you about mental health. My name's Madeline.
My name's Alyssa.
My name is Chris.
And my name is Jordan.
All right, so let's start with defining mental health. So mental health is defined as the emotional, behavioral, and social well-being such that an individual can cope with internal and external events. Psychology is defined as a scientific study of behavior and mental processes. A licensed specialist in psychology is referred to as a psychologist, who can have either a master's, a PhD, or a PsyD. A mental disorder can be defined as any behavior or emotional state that, 1, causes a person to suffer emotional distress, 2, is harmful to the individual sufferer, 3, is self-destructive, or 4, endangers others or the community. All right, so affective means pertaining to mood or expressing emotion. In Latin, affects means state of mind. Affective disorders include mood disorders of unipolar and bipolar depression. There is not a clearly delineated group of disorders for affective disorders. All right, so major depression is when a person is so deeply sad for at least 2 weeks that they feel despairing and hopeless, see nothing but sorrow in the future, and may not want to live anymore. They may see themselves as worthless, unlovable, and may struggle getting up and starting the day. Violent behavior or substance abuse occurs more often in men than in women, although depression is more common in women as a whole. Depression is primarily a result of poor communication between the brain's thinking prefrontal cortex and the limbic system. Together, they make up the frontal limbic system, which regulates your emotional state. All right, so mania is an excessive state of overexcitement and impulsive behavior. It's the alternation of episodes of depression with mania is referred to as bipolar disorder. It used to be called manic depressive disorder, but that is now an outdated term. Bipolar disorder affects the prefrontal cortex of the brain, and it is also noted that people with bipolar disorder have a smaller prefrontal cortex than with people who do not have bipolar disorder. Dysphoric mania is also a form of bipolar disorder and combines frenetic energy of mania with dark thoughts and paranoid delusions. So seasonal affective disorder is a mood disorder associated with episodes of depression during the fall and winter months, subsiding during spring and summer. It can be helped by phototherapy with bright white fluorescent lights and also helped with antidepressant drugs.
Anxiety disorders. Anxiety disorders are the most common category of mental disorders in the United States. They're characterized by an unreasonable anxiety or fear that is inappropriate to the circumstances of a person's life and disrupts their life. Scientists believe that anxiety arises from the amygdala in the brain, and there are 5 types of anxiety disorders. First, you have generalized anxiety disorder, also known as GAD, which is persistent excessive worry and uncontrollable fear that is not focused on any particular situation. The person's often frightened, but not able to articulate the specific fear, and these symptoms have lasted for at least 6 months. Next, you have post-traumatic stress disorder, also known as PTSD, which occurs when a person has undergone a specific or significant trauma. Often we think of this to only be soldiers, but anyone can have PTSD who's undergone significant trauma. It could be someone who's been physically or sexually abused, or if they've had a loss of a loved one. These symptoms last longer than a month. Next, you have panic disorder, which is sudden, brief attacks of intense fear that can cause physical symptoms. The fear arises abruptly and often for no reason. It peaks within 10 minutes or less and often runs in families. Next, you have phobias. Phobias are a specific situation or object that brings a strong fear response. You have your situational phobias, which is fear of specific situations, such as acrophobia, which is fear of heights. Or for me, arachnophobia, which means fear of spiders. You also have your social phobias, which are fear of being embarrassed in social situations. People often have a fear of public speaking, which is also known as stage fright. Next, you have obsessive compulsive disorder, or OCD, which is just a combination of someone who has both obsessions and compulsions. Obsessions are recurrent thoughts, fears, and doubts. And compulsions are reoccurrent, irresistible impulses that perform those certain actions. So they're constantly obsessed with something and thinking about it, and then they have to act on it because they can't stop thinking about it. And impulses can range anywhere from just a routine that they do in the morning when they get out of bed, or when they leave a room having to flicker the lights on and off 3 times. Then you have some word elements. Som, meaning to sleep, which can come from the word insomnia, which can be created by someone who has had generalized anxiety disorder over a period of time, which just means lack of sleep. Then you have phobia, meaning fear. Example being agoraphobia, which is fear of being trapped in a public place. Then you have compulsion, coming from compulsion, which just means to drive or compel. Obsess, coming from obsession, which is besieged by thoughts, being controlled by your thoughts. And traumatic, coming from traumatic or post-traumatic stress disorder, which is meaning wound.
Okay, so another mental health disorder is schizophrenia. Schizophrenia is a type of psychosis with the word psych meaning mind and the suffix osis meaning state or condition. It is a disorder affecting cognitive, mental, emotional, and behavioral aspects. It is generally known as one being out of touch with reality. So some terminology for schizophrenia and schizophrenic. Schizo with the combining term is to split. Phren, meaning mind, and ia is condition, while ik is pertaining to. So to be clear, schizophrenia is not to be mixed up with schizoid or split personality disorder. Schizophrenics, what they do is, what they say doesn't always correlate to what they particularly mean. Sometimes they're very disconnected from reality, and the things that go on in their mind aren't as clear to someone that's looking at them what's going on in ours. Their thoughts don't quite equal their behaviors, so what they're thinking is not what they're doing sometimes. Some signs and symptoms of schizophrenia. One would be hallucinations, and the other would be delusions. Hallucinations are sensory distortions, and the main sensory distortion is of the auditory. Delusions are false beliefs. Some types of delusions are paranoias and then withdrawal. Paranoias are trust issues and suspicion of someone out to get them. Withdrawal would be leaving the scene of society from your personal life, as in like your family, your friends, your spouse, and not being able to communicate with people or not wanting to communicate. Some more symptoms would be catatonia, which is a motor function affection where the individual is immobilized briefly and we can't figure out why, but they come to and everything's back to normal. They also have disorganized and incoherent speech. So some words might not connect to another word that was in the sentence that they just said. They also go through something known as mutism, where their inability to speak or the refusal to speak. Some other signs are disturbed sleeping patterns, aggression, and then inappropriate behaviors. So laughing in a non-laughing situation, like smiling and giggling at a funeral or something. The prevalence of schizophrenia is usually in the late teens and throughout the 20s. There's really no cure for schizophrenia. So therapists and doctors usually prescribe medication and refer the individual to a rehabilitation clinic or a separate psychotherapy or something of the sort.
Okay, so the next mental disorder I would like to talk about is personality disorders. So a person's personality is made up of a combination of unique and stable patterns of thoughts, feelings, and behaviors. and these are in response to different situations. So whenever these patterns become rigid or inflexible, they can lead to impairment of that person's ability to deal with specific situations or even function socially in any capacity. So these personality disorders are all affected by the frontal lobe of the brain, which is where the personality stems from. The first type of personality disorder I'd like to talk about is dissociative disorders. So these cause a splitting apart of past experiences with the person's present consciousness. So the most extreme type is DID, which is dissociative identity disorder. And the treatment for this is psychotherapy. So dissociative disorders are caused by a feeling of a need to escape an extreme trauma that they experienced in their past. And this can be a physical, emotional, or sexual abuse type trauma or anything like that. The next type of personality disorder is impulse control disorders. So some examples of these are kleptomania, pyromania, and substance abuse. Kleptomania and pyromania both end with the suffix mania, which means an excessive desire. So these excessive desires that these people experience normally are very detrimental to either themselves or others. Kleptomania meaning the desire to steal, and pyromania a desire to play with or set fires. And the treatment for this would be behavioral therapy, which is sometimes successful. So borderline personality disorder, or BPD, is the most prevalent form of personality disorder. People with BPD experience signs and symptoms of impulsiveness, unstable mood changes. So these people will be happy one minute and can go to very angry or sad within very little time. They're very manipulative and experience self-mutilation. This can go to the extreme of suicide. These people are also very narcissistic in some cases, which means that they have a very exaggerated sense of self-importance. And at the time, there is no successful treatment for BPD. So the next one is antisocial personality disorder. Some synonyms that go along with this are sociopath and psychopath. So this is the disease or suffering of social interaction or the mind. Some signs and symptoms that these people will experience are excessive lying, cheating, stealing, and they're normally very violent and angry individuals. And the telling sign that they'll show is that they will feel no sort of guilt or remorse or have any type of anxiety for these things that they've committed, such as lying and cheating and stealing. And like BPD, there's no successful treatment as of now. And the last personality disorder I'd like to talk about is paranoid personality disorder. So some signs and symptoms of this are a person who's very self-absorbed, very untrusting, and fearful of closeness with others. So people with this type of disorder usually don't have a lot, if any, close relationships with others. They feel a very separated or divided type feeling from the rest of society, and at the time there's no treatment. So the prevalence of personality disorders as of last year is about 9.1% of all adults, so that's 18 and above, and BPD is the most prevalent. The treatment we talked about a little bit. In some cases, behavioral therapy or psychotherapy can be useful, but in other cases, there is no type of treatment for personality disorders.
Thank you so much for watching. Hope you enjoyed.